Cooper.
Good morning.
How are you?
Good, thanks.
Good. All right, Dr. Cooper, can you tell us a little bit about yourself?
I certainly can. I'm Dr. Cooper, and I am excited to be opening my own hospital in Las Vegas. So I graduated from the University of London in 2002 from the Royal Veterinary College.
That sounds fancy.
I get that a lot. I graduated from the Royal Veterinary College in 2002, and I worked in small animal private practice in the UK for about 10 years. I was in my first job for a year. But I was there for a year. It was a really big, good hospital with lots of really great vets there. But then a role came up near my house, and I managed to get a job there. So I was there for 9 years, and I was a vet, and then the lead vet. And then at some point during that time, I came to America, and I met my love of my life and my now wife. And I moved over here, so I started work in the US with Banfield Pet Hospital in Las Vegas. So I was inside a PetSmart, and I was an associate vet. And then as I got more experience and got used to kind of some cultural differences and the way we practice medicine, I became a chief of staff, and so I oversaw a hospital, then a few hospitals, and then I moved up into leadership and was in a role where I oversaw a group of hospitals. So at that point I was just a people leader. I didn't see patients or appointments at that point unless I was training. And so I loved that. There was lots of travel, and when I was in that role, I ended up overseeing, I want to say, 10 hospitals in Vegas, 2 in Reno, and 17 in San Diego. So I was really lucky.
All at the same time?
All at the same time, yeah. So I love the travel. Reno, Tahoe area is lovely, and San Diego is beautiful. So I really like that. But then my mum got sick, and I couldn't give emotionally what that role required. So she's okay now, touch wood, she's doing well. So I wanted to step back from leadership, and so I went back into clinical practice and went through emergency medicine. So I've been doing emergency medicine for the last couple of years, which I've really loved. And then the opportunity came up to open my own hospital in a brand new building, and it'll be a brand new hospital, which is going to open on the 1st of February. So I am super excited. I can't wait to do that. Thanks very much. So on the 1st of February, I'm going to plug the event now. So the grand opening will be from, hey Zeke. One of my cats, Taziki. Yeah, all of my animals have food names, which we'll come back to. Okay. So Zeke, you're interrupting my plug. So shameless plug. 1st of February is our grand opening. We'll be partnering with the charity Positive Difference. And so between 10 a.m. and 1 p.m. on Saturday, 1st of February, we'll be doing a low-cost vaccine and microchip event. So it'll be $10 per vaccine, $10 for a microchip.
That's a great price.
Hopefully, yeah. So we'll be able to get some pets preventative care there, and microchipping. So just in case the worst happens and they go missing, we have a way of reuniting them. So yeah, we'll have more to come on the website and on our Facebook page. So please check in there, and we'll hopefully see you on the 1st of February.
Yeah, we will. We will be checking in. It sounds like you're very passionate about what you do. Can you tell me some things that you love about being a veterinarian?
Oh, that's kind of easy to answer, but then I go down rabbit holes. I love being a vet. The only thing I really don't like very much is
another visitor.
Oh, hey! So I don't know if you can see him down here. Hey, Spud. So this is Spud, another food named animal. He's our 3-year-old lab. He feels nice and warm. He's been laying out in the sun. Yeah. So I love everything about my job. Things I really love. 10-week-old puppies are like the most fun to me.
Who doesn't love a puppy?
Correct. So I love those, but yeah, and I love medicine. I love surgery. I love dentistry. I love meeting people. So yeah, I love being a vet. It's one of my favorite thing. I feel so privileged that I get to do it. I think is a great profession, and I feel privileged that I wake up in the morning and I'm excited to go to work, and then I see different things. I mean, a lot of it sounds cliched, but yeah, I'm privileged for sure.
Great. Not everybody has that. That's wonderful. So obviously there's a lot that you do love. What do you not like?
Typing.
Typing.
Yeah, the less time I can spend in front of a computer, the better. I type like this for the purposes. For anyone not watching, I'm doing woodpecker movements with my fingers, and about 75% of my keystrokes are backspace or delete, which is frustrating. But now we have AI at least. So in the hospital as well, we use that. So it's great. We do, yeah. So we let our owners know. And clients, pet parents know, but the AI helps transcribe the appointment basically, and it's great because it frees up my time to be more with owners, hands-on with the patients, and then hands-on leading my team is important for me. But also it's way more efficient, but it's more accurate as well. So the AI captures the whole conversation, and whereas if I'm typing it, I'm inevitably going to miss something or be rushed, so it's a better way of doing it. So at least I spend less time doing the thing I don't like.
Oh, that's great. Okay, so you don't like typing. What about euthanizing pets? What are your thoughts around that?
Oh yeah, that comes up a lot. I think it's a valid assumption that vets wouldn't like, and I think there are lots of vets that probably don't care for that. For me, it's one of the most important parts of my job. I think when the time is right, pet parents and families need that guidance and deserve that guidance. And we factor in a lot of things, whether it's prognosis, how much a patient might be suffering financially, that factors in as well. When we're recommending treatments and possible outcomes. So I find it rewarding is probably the right word, when I can make that process a bit smoother, and just when the time is right, I want to lean into that discussion and be there for my clients.
That's lovely. Makes me want to cry.
Don't cry.
Okay, so back to Grand Teton Animal Hospital. What services will you be providing?
Oh yeah, so the hospital, Grand Teton Animal Hospital, as you mentioned, the southeast corner of North Decatur and Grand Teton, in Las Vegas, not Wyoming. So pretty much everything. For me, being a primary care or first opinion general practitioner, I love preventative care, and I love helping owners and pet parents keep their pets as healthy as possible. And so prevention is huge. But I'm also, and when I was in the UK, I did a further qualification in small animal medicine. So that's mainly dogs and cats, but it was writing up a big case log, and then writing up cases, and if they were approved, a written exam and an oral exam. So that was pretty rigorous, and it really helped kind of tighten up my medical quality. So I love medical cases, I love dentistry, I love surgery, and I do. But and also being thorough is really important, because it helps you get to the point of, if you do need to go and see a specialist in town, whether it's a more complex medical case or surgical case, or even cancer or emergency and critical care, you kind of get there more quickly. Like working in emergency, sometimes they see cases come in and they've already been through weeks or even months of therapy, it can sometimes be a bit more difficult to treat at that point. So I love first opinion practice. I love working up more complex cases, and I have a really strong partnership with the specialty hospital as well in Vegas. So, but we'll be pretty comprehensive. Like,
sounds like full service.
Oh, full service, and also USDA accredited. So if you're traveling domestically or internationally, we can take care of that as well. There'll be another vlog
Traveling
with your pet. Yeah.
Okay.
Oh yeah, I can't help you if you're not going with your pet. Don't come to me. Just if you're traveling.
What do you provide? Papers? Do you paperwork?
So either domestic or international health certificates, and they can vary a lot, and they can be really picky, especially if you're going to areas of the world where certain diseases are not endemic. For example, rabies would be a big one. So there are some really strict requirements for travel, and it can be quite a lengthy process. So we'll do another vlog on that and have some snippets of information, but we can facilitate that as well.
Thank you, Dr. Cooper. All right, so full service at Grand Teton Animal Hospital. You do it all.
That's us.
You do everything.
That's us.
In Las Vegas. What else do we have to look forward to?
So I mentioned the opening day, and the grand opening will be on the 1st of February, and the low-cost vaccines and microchips. And then from that Monday, the following Monday, the 3rd of February, will be open. We're not scheduling appointments that week. We will, if anyone shows up, we'll see you, but we've got some training to do and just making sure all our systems and equipment are working properly. And then we'll be scheduling. The website is pretty much built out now, so that will be going live soon. So we have our vlog. This will go up on our website and our YouTube channel. And then we'll break down some kind of snippets to go on our Facebook page. So please kind of start to like and follow those things. And as I mentioned, just let us know your thoughts, what went well, what you think we could do differently, topics. We look forward to meeting some or many of you going forwards.
Awesome. Thank you, Dr. Cooper.
Thanks, bud.
And Spud.